My patient is a 63-year-old lady. She was an involuntary commit to the geriatric behavioral unit on February 11th for major depression, disorder reoccurrent, severe without psychosis. Some subjective behavior I got from her is that she got her ECG and she's going through 6 sessions of it, and she was gonna let me come with her during the later session in the afternoon, but I was not able to. She stated that I have been diagnosed with depression since she was a teenager. She also stated when she gets nervous or agitated, she picks at her thumbs and bites her nails. She said that she was medication resistant, and she also stated that I was feeling suicidal coming in for my recent admission, but now I'm depressed because of all the negativity from the news, social media, and talk radio. And objective findings I found was her vital signs. Her temperature was 97.8. Her blood pressure was 130/70. Her heart rate was 71. Respiration 18. Weight 167 pounds. BMI, she was overweight with 29.15. And her OSAT was 98%. And her last ECT was February 15th. My initial findings from my patient was she was having a so-so day. She was being calm and quiet until I asked to talk with her. After getting to talk with her, she became more open to talk about depression. Her thumbs were red and looked bloody from her picking and chewing because that was one of her nervous tics, and she kept to herself in the day room all day. Her priority problems is safety, coping strategies for suicide thoughts and plans, and stabilizing her medications. For patient needs, the patient will attend group therapy to help cope with depression and suicidal thoughts. She will eat at least 50% of meals and get at least 6 hours of sleep each night. The patient will take her medications when the nurse gives them and not refuse it. Patient will use coping strategies and therapy to help bring positivity, and patient will identify reasons for living for 3 days. And the intervention needs is the nurse will encourage patients to take all of her medications to help with depression and suicidal thoughts. Nurse will help and assist the patient in coping strategies about suicide. The nurse will have patient to verbalize 2 coping skills to help manage depression symptoms. And everyone's emotions. The patient was very talkative in the morning session after breakfast and at group therapy, but after lunch, all the patients became sleepy after taking their medications. Nurses were very short-staffed on my unit, but we were very willing to answer any questions. They were able to answer any questions that we had about the patients, and the nurses and staff worked well with the patients and us as nursing students. The responses and changes to the plan. My patient, she was not compliant with medications this morning. Didn't get to see medication administration during the afternoon because we had to leave. She attended group therapy and participated in all the activities, but was very closed off and quiet. And after lunch, she went back to her room and fell asleep. So I didn't have another chance to speak with her. Skills performed, use therapeutic communication my whole day on the unit with the clients and my patient. Also with process recording, assisted with ambulation of client from chair to bed. The nurse for effective communication, the nurses had effective communication when we were talking about information about the patients. Helpful when asking how to ambulate patients, and gave effective communication about different medications. Differences in my plan from my clinical. From today, I wish I could have been able to talk to my patient after lunch more about her suicidal thoughts. She only mentioned it once in our conversation when talking about not being suicidal and just depressed now. I wanted to ask more information about why she was suicidal and how she could talk more positive and use coping strategies to help. And pros from clinical, I gained trust in my patient and I helped out the staff on the unit with different tasks and skills. My cons, not being awkward during my process recording when trying to ask questions and respond to conversations going at the beginning, and picking my patient sooner rather than later. My overall experience, I thought today in the behavioral health unit was really good. I feel more comfortable with the patients and staff. I had better communication skills with my patients. I did a better job being open and communicating. Today I had a better process recording with my patient and I felt more relaxed on the unit.